Surgeons at Ascension Columbia St. Mary's Hospital on the east side of Milwaukee have been using robots like these to carry out complex procedures every day. This week, some teenagers, some of them hoping to be doctors someday, got the chance to get behind the wheel. They sat at these monitors using the controls to maneuver tiny surgical tools, kind of like a video game.
They're easier to train than older folks like myself.
The student-executed procedures were fake, but Dr. Fred Westreich says the robots help real patients feel less pain and recover quicker because urologists and OBGYNs use the machines to be less invasive and more precise in their procedures.
It puts me inside the abdomen, right next to the blood vessel that needs to be stopped or a ligament that needs to be cut.
Students like Natalie Guest say working the robots is not as hard as it looks.
I think after actually trying it, it's a lot easier, so I was really happy to find that out.
She and her classmates left the hospital with a greater appreciation for the complex work surgeons carry out.
It's amazing to see that we've come so far in medicine.
Now, doctors at Columbia St. Mary's on the east side have been using those surgical robots for several years, but at some of Ascension's newer facilities across the area, Vincent Elise, those were just introduced earlier this year.
Well, it's really important, yeah, for those students to get their hands on it because they're next.
They are next.
We need them to figure this stuff out.
Cool stuff. And they let me mess around with them a little bit too before the kids got there.
Now that I don't advise.
Not as well as them. But also it's deceptively easy. Like it looks like it'd be really hard to be controlling these tiny little things, but it almost just goes with the flow of your hands and your wrists. It's kind of cool.
Be careful what you say though. You might get a lot of emails now saying it's deceptively easy.
Yeah, that's true.
That's true.